So this is the base of the skull, anterior cranial fossa. Okay, anterior cranial fossa. It is formed anteriorly by the frontal cable or inner surface of the squamous part of the frontal bone, and posteriorly it is formed by the posterior border of the laser wing, anterior cranial process, and this is the sulcus chiasmaticus, anterior cranial process, and posterior border of the laser wing of sphenoid bone. Okay, and middle cranial fossa. Okay, it is formed by the anteriorly these, and posteriorly the superior border of the vitreous part of the temporal bone, and the medially this is the dorsum sella, and a posterior clinar process. This is the posterior clinar process. Is the or it is also okay. So this is the sulcus chiasmaticus, and this is optic canal. This is supraorbital fissure. তারপর হচ্ছে যেটা হচ্ছে tuberculum silla, hypophyseal fossa, dorsum silla. Okay, and it is the apex of the vitreous part of the temporal bone, where attaches the where is a depression in the trigeminal ganglion. There is also elevated area which is called the arcuate eminence, and it is formed by the semicircular canal of the internal ear. And এটার পরে একটা থিন প্লেট অফ বোন থাকে, যেটা নাম হচ্ছে টেগমেন্ট টিম্পানি, হুইচ ফর্মস দ্য রুফ ইন লিভিং বডি থাকে, and which forms the roof for mastoid and from tympanic cavity at bony part of the auditory tube. And this is the petrous part of the temporal bone. In the superiorly there is superior petrosal sulcus, where lodges superior petrosal sinus. Inferiorly there is inferior petrosal sulcus, where lodges the inferior petrosal sinus. Okay, this is the frontal plate. So foramen cecum, pristagal, and cubriform plate. There is several foramens in the cubriform plate. Okay, this is the jugum sphenoidally. Okay, this is sella turcica. This whole is called sella turcica. It has three parts: tuberculum sella, vitreous fossa, and dorsum sella. And in the anterior clinar process, it provides attachment to anterior end of free border of tentorium cerebelli. Or the posterior it provides attachment to anterior end of attached border of tentorium cerebelli. And tuberculum sella provides attachment to diaphragma sella, which forms the roof for the hypophyseal fossa. And there are several foramina. There is the foramen rotundum, foramen ovale, foramen spinosum, and this is the foramen lacerum. Okay, this is the internal acoustic meter in the jugular foramen. Okay, and this is the clavus. Okay, that extends from the dorsum sella to the anterior margin of the foramen magnum. This whole part is called the clavus. Okay, from foramen rotundum there it transmits maxillary division of trigeminal nerve. Foramen ovale it transmits male mandibular division of trigeminal nerve, accessory meningeal artery, lesser petrosal nerve, which is a branch of glossopharyngeal nerve, and emissary vein. Okay, internal acoustic meters, it transmits facial nerve and vestibulocochlear nerve. Facial nerve enters through it, and also the labyrinth vessels. And through the foramen spinosum it passes 3M, medial meningeal artery, medial meningeal vessels, meningeal branch of mandibular nerve. Okay, this is the foramen lacerum. It transmits internal carotid artery image. Okay, internal carotid artery, meningeal branch of ascending pharyngeal artery, greater petrosal nerve, and emissary vein. This is the jugular foramen. Medial, it is divided by into three compartments: medial, intermediate, and lateral. Okay, medial it has inferior petrosal sinus, meningeal branch of ascending pharyngeal artery. In the intermediate, it transmits glossopharyngeal nerve, vagus nerve, and accessory nerve. And lateral compartment it transmits sigmoid sinus and meningeal branch of occipital artery. This is the foramen magnum. It is divided into anterior division and posterior division by the alar ligament. And anterior division it transmits apical ligament of dens, membrana tectoria, and upper band of cruciate ligament. And posterior division it transmits lower part of pons made of oblongata with meninges, anterior posterior spinal arteries, and spinal root of accessory nerve, and tonsil of the cerebellum. This is the hypoglossal canal. This is the hypoglossal canal. It transmits hypoglossal nerve, emissary vein, and meningeal branch of ascending pharyngeal artery. This is the stylomastoid foramen. It passes. It transmits facial vein which emerge from this and enters through the internal acoustic meatus, and also it transmits a stylomastoid artery. আচ্ছা, এটা হচ্ছে ফোরামেন ওভ্যালি, এটা হচ্ছে ফোরামেন স্পাইনোসাম, এটা ফোরামেন ল্যাসারাম, এটা হচ্ছে ক্যারোটিড ক্যানেল। ক্যারোটিড ক্যানেল এখান থেকে দেখতে হইলে ক্যারোটিড ক্যানেল হচ্ছে এটা হচ্ছে ক্যারোটিড ক্যানেল which transmits internal carotid artery. এটা হচ্ছে palmian fossa, internal occipital protuberance. And it is superior orbital fissure where transmits oculomotor, trochlear abducent, and the ophthalmic nerve and ophthalmic veins. So on each side of the body of this vena there is sulcus, or where is cavernous sinus. Cavernous is of the internal carotid artery. So what is cavernous sinus? It is a dural large venous sinus because it is formed by the dura mater and it receives blood from brain, meninges, and also skull bones. All venous sinus are formed by dura mater. Floor and medial wall formed by industrial layer, and roof and lateral wall formed by the meningeal layer of dura mater. Venous sinus communicates outside of the brain through emissary vein. No muscle lining epithelium is endothelium. Extends from medial part of the supraorbital fossa up to the apex of the petrous part of temporal bone. Contents of cavernous sinus in insulateral wall lay থাকে from above downwards, oculomotor, trochlear, ophthalmic nerve, and maxillary nerve, which is separated by a sheath. And medial wall থাকে internal carotid artery and abducent nerve. Medially থাকে carotid sulcus, internal carotid artery থাকে. So communication cavernous sinus communicates with transverse sinus through superior petrosal sinus, and communicates with internal jugular vein through inferior petrosal sinus, and facial vein through superior ophthalmic vein, and right and left cavernous sinus communicates with each other through anterior posterior intercavernous sinus. And what are the tributaries? Superior and inferior ophthalmic vein and central vein of retina. And what is the clinical importance when any infection occurs within the face, danger area of the face, then what is the danger area? Upper lip and lower part of the nose and paranasal sinus. Okay, then infection enters from outside to the cavernous sinus, and thrombosis occur within the cavernous sinus. After then venous drainage or blood from supracellular sinus to heart, how it drains. Okay, supracellular sinus, then transverse sinus, then sigmoid sinus, and internal jugular vein, which unites with subclavian vein, then from brachiocephalic vein, and right and left brachiocephalic unite, and from superior vena cava, superior vena drains into right atrium of heart. And what is the how internal jugular vein is formed? It is a continuation of sigmoid sinus. And what is function of external auditory meatus? It is a passage for conduction of sound waves. And what is the nerve supply of facial muscles? Facial nerve